Hey there, my name's Chris, and today in this video we're going to be reviewing Nebulizer Medication Administration, as well as the proper way to clean the equipment when we're all finished. You can use this video to brush up on your skills, as well as prepare for the upcoming skill validations that happen annually. Without further ado, let's get started. Before starting, you'll want to perform the beginning 5, and that is to assemble the equipment, knock on the door, identify the resident, explain the procedure and provide privacy, and conduct hand hygiene. Then you'll want to set the controls and the flow rates on the nebulizer machine according to the order, and in most cases, these controls are not present on the machine, but it's something to be aware of. Next, you'll want to listen to breath sounds and count the pulse to establish a baseline. And if the medication or dosage has changed, pulse should also be monitored during the treatment, and if the pulse increases more than 20 beats per minute, medication should be discontinued and the physician notified. To prepare the nebulizer, you'll want to place the medication inside the nebulizer cup and connect the nebulizer to the air source. In most cases, this is the nebulizer machine. If a mask is used, you want to check proper placement before starting. Then instruct the resident to inhale slowly through an open mouth if using the mask, or with closed lips around the mouthpiece if using a mouthpiece. You want to instruct the resident to periodically hold their breath for 2 to 3 seconds and then exhale slowly. You should be monitoring the resident for presence of any side effects such as tachycardia, tremor, and nausea, and when the treatment is finished, encourage coughing and expectoration. You'll then obtain post-treatment data. This is things like the pulse, the breath sounds, and any side effects, and record that in the medical record. Once again, if the pulse is increased more than 20 beats per minute over baseline, you want to notify the physician. After treatment, you'll perform the ending 5, which is to remove your gloves, perform hand hygiene, leave the resident in a comfortable position, make sure that the call light is in reach, and document appropriately. And following the medication administration, you'll rinse the equipment with hot water and place on a paper towel to air dry. Then, wash your hands. Once per day, we need to clean the nebulizer equipment. And to do that, we're going to turn off the power switch and unplug the power cord from the wall socket. Then we're going to disconnect the air tubing from the nebulizer. An important note is to not wash this tubing. You'll replace the tubing when the nebulizer cup is replaced weekly, or you can replace it as needed, but we are to not wash it. You then want to wash your hands and completely disassemble the nebulizer parts. You'll wash all non-electrical parts in hot water with a dishwashing detergent, and rinse the parts under running water for at least 30 seconds after. Then you'll place the parts in a solution of 1 part white vinegar, 3 parts hot water, and you'll put that in a clean container. We're going to use fresh vinegar solution each time the nebulizer is disinfected. We'll let the parts soak for 30 minutes in that vinegar water solution, and then remove with clean hands. You'll then want to rinse the parts under running water for at least 30 seconds, and then finally place on a paper towel that's clean to air dry.